Waiting for a fearless leader.
We'll call this meeting of the Intergovernmental Relations Committee to order. Agenda review and minutes review of September 6th. Did anybody have any additions or corrections to the agenda and or minutes from September 6th? Seeing none, we'll entertain a motion to accept the minutes.
I made a mistake and I sent out the wrong documents, and I'm just seeing those right now. And I sent out the ones.
Yeah, it's saying October 4th.
Yeah. So if you give me just 2 minutes, I can go down, grab my laptop, and I will I'll have them for November rather than October.
Yeah, I just noticed that. Yep. It's okay. I get discombobulated too, trust me.
1 month off isn't that bad.
Well, and of course, the terrible thing is that I actually looked at those and thought, oh, those look familiar. I didn't look at the date. I thought we're having that conversation again. I just
every day feels like Groundhog Day to me lately.
Yeah.
Yeah, I always go through a state of confusion when the clocks roll back.
Oh yeah, I know.
Well, I think we got some clear direction just now with ballot measure 110 reform. So we should sail through that pretty quickly.
Yeah, that was good. That was good.
Is that sweatshirt for your new job, Greg?
Yeah, it is.
You're already representing.
They gave me gear,
That's cool. I like
swag.
Yeah. A little swag.
How long have you been there now? Has it been like
it's been a month.
Only a month. Okay.
It's a month. It's been an interesting month too.
I bet.
Yeah. I've talked to your husband more in the last 3 weeks than I have in 3 years.
Oh, that can't be good.
It's all right. We got it figured out.
He didn't give me details, but he told me he was working out some stuff with you.
Yeah. We're working stuff out.
I'm going to send an email to you all with the responding to the one that I sent on out, and I will add the documents there. And I'll just take 1 second to connect to our. All right, I just sent it, and it also went to the 0619.
Gotcha. Okay, let me pull it up.
No, this is the same, I think I got version control, my documents got. The reason why you got the. Yeah, my apologies, folks.
I still got October 4th.
Yeah, it didn't save on over the updates that I sent. Okay, well,
Can we wing it?
I think we can, because what we would have is, if I can just give you a quick amended agenda. What I would say is that we have the meeting to order, we skip minutes review for this month, and we come back in December with minutes review. So under agenda review, a revised one would be no minutes.
No minutes, okay.
We strike number 3, which is the overview by IGR manager meeting process. We go to number 4 becomes number 3, which is action and review current Oregon priority document. That one is current, which was sent on out. And instead of provide feedback, I would say take action. And then for number 5, it becomes number 4, action, review current state federal policy document, scratch provide feedback and say take action. And then scratch number 6 and go number 7 becomes number 5 as items for committee members and good of the order.
Okay. So why don't we start at number 3, since we have punted the agenda review and the minutes to December. So item 3 would be the 2023 Eugene state priorities.
And I just want to make sure that the revised agenda is appropriate for everybody, and then when I go back in, I will approve that, or I'll update that.
I'm good.
Okay. Councilor Gross.
Yeah. Okay, great.
All right, thanks for being
So do we have any questions or discussion on the state priorities? Again, we are going to be going for funding with Clear Lake Road infrastructure, Crow Road infrastructure as far as the residential housing piece is concerned, community center, clean air upgrades, and police body and dash cameras for the short session. Is that correct?
So, Councilor Evans, the document that was sent out in the email for this has a revised priorities. And one of the reasons why Deputy Chief Heppel is with us today, is because we've added, and internally we had discussions about seeking one-time funding to provide community response due to the Peace Health University District closure.
Right. Okay, that is right.
So I'd like to be able to turn it on over to Chris, Deputy Chief Heppel, for us to talk through what this is. Because I think that Mayor Vinnis has been at the table with Representative Nathanson and other community leaders. Representative Nathanson has put forward a proposal, and Chief Heppel is ESF's lead for then what that proposal at the legislature would be. And so that's now, instead of unhoused priority, that is the city staff's recommendation that this funding become our number 1 priority for the legislative session. I spoke with Chief Caven, with the executive team, with the assistant city managers and the city manager, and they said, yeah, we believe that this needs to be number 1. So,
okay. Well, why don't we let the deputy chief take it away?
Do they have any documents, or am I starting from scratch?
We're going to start from scratch. The only thing that they have is just where we're seeking funding. So I think that if you wanted to dive, and I want to just put one more caveat. We didn't send any documents out because Representative Nathanson has asked this to be confidential, the legislative concept. And so I checked and we've got approval to talk in broad strokes, and then we can talk about what this means at Eugene level, which is what Chief Heppel will be able to talk about. So you didn't get anything you can talk about there.
Mayor, councilors, thanks for this opportunity to chat with you a little bit about the challenges that we're experiencing with the Peace Health System. I'm sure you've you've heard about the impending closure of University District Emergency Room. There's also some ancillary components that are associated with that as well. Obviously, the challenge that we're going to experience with that is we no longer have an emergency room in Eugene, which is one of our 3 primary destinations for our ambulance system. On average, we take about 13 patients by ambulance per day to University District, and we transport approximately 8 per day out of there. So cumulatively, we're looking at over 20 patients a day coming in and out of that particular facility. Many of the folks who go to that facility don't necessarily come by ambulance. In fact, most of them are either drive themselves or many just walk to that particular facility. The challenge that we feel we're going to run into is the hole that this is going to create, obviously, within our downtown system. We also want to acknowledge that there's going to be an impact on the University of Oregon, as many of their students during off hours that their clinic is not open will just walk themselves over to University District and aren't going to have that option going forward. I think the other piece is to acknowledge the challenge around folks and that the ER many times is their primary care. Because they don't have access via other means, or they choose not to use access via other means, and they choose to go to the emergency room. We've been working, for the last few years to infuse some innovative concepts into our system to help just blunt the system as a whole with regards to alternative transport. And after some conversations with Representative Nathanson, about 6 weeks ago, after the announcement of this with Peace Health, she said, hey, why don't you go ahead and throw some innovative or bridge type things my direction and see what we can do. In this particular case, we anticipate we're going to see an increase in ambulance transport. We ran actually quite a bit of data to go ahead and see what that impact is going to be. Interestingly enough, we anticipate just the mere fact of taking the patients that we have, so using current call volume and taking them to either Riverbend or to McKenzie-Willamette, plus the patient offload time, plus the time to get back into their system, adds 27 minutes to every call, which in our total system adds about 5.5 hours per day of unit time to our system. And so our ambulances run 24/7 with the exception of our basic life support ambulances, which run 12-hour shifts. So you can see it's basically half of a BLS ambulance car per day increase in just time on task. And that's not taking into consideration folks that would normally have just walked to University District and now are probably going to utilize the EMS system to get themselves over to Springfield. And whether that's McKenzie-Willamette or Riverbend. And so 2 of the items which I sent over to Rep. Nathanson, I've been working with Ethan on. The first one is actually a nurse navigation system. This was actually, we first brought this up in 2018 when CSI was just starting to emerge. And we looked at nurse navigation within our own comm center. The realities of that was very difficult just because of staffing, protocol, et cetera. In the last 5 years, that concept has modernized or matured to where there's now a nurse navigation system that's available by a company called Global Medical Readiness. Councilor Goes, remember, it's actually owned by, which actually owns American Medical Response, which is the largest ambulance transport provider in North America. And they actually came out and did a presentation on our system. Or for our system. They're currently deployed in 25 cities, large cities across our country. The most recent one is Vancouver, Washington. They just started in the spring. And they've also been in Seattle and Washington, D.C. for 3 to 5 years now working the system. And what nurse navigation is, it really takes a lot of those lower acuity, lower echelon calls, things as simple as what is the dosage for Tylenol for my kid? We actually get those calls in the 911 center, right? And it shifts those to this system. And then this system, depending on the resources we have available in our local area, can real-time iCall or use divert or redirect folks to more appropriate services. So it could be just simple self-care. In fact, 45% of the calls that are resolved by nurse navigation is just simply advice over the phone. It could be a community response unit, which I'll talk about in a moment. It could be Cahoots. It could be a street outreach program. It could be connected into 988 rather, in that piece, and then they can solve their problem using more appropriate resources in our community. There is a level of calls that do come back into our system where the nurse navigation system isn't able to resolve that, and then we'll certainly send folks out. So I presented this in the sense that it was looking at it as a 3-year pilot project. It's at about $2 million for this project. It actually impacts us regionally. It's not just the city of Eugene. It would support the Springfield area and our surrounding metropolitan area because it would actually be run through our 911 system. Any questions on that one? Councilor Gross?
Thank you, Chief. So nurse navigation system, is that kind of a new iteration of Doc in the Box?
So Doc in the Box or telehealth is one of the resources that's available to nurse navigation. So if they feel that the nurse feels like, no, actually telemed would be good for you, they actually can connect them via telemed. The interesting part is they can provide the telemed, or we can connect you to your system's telemed. So if you're a Pacific Source patient or OMG or something like that.
So this is another layer then on top that helps sort ahead of Doc in the, or I just know it as Doc in the Box.
Yeah, absolutely. There's Doc in an iPad. No, Council, you're absolutely right. It's a real-time sorting, and where, as I put it, the system before 911 wasn't successful, so the person has now had to call 911, but it's still not the right thing. How do I get you redirected back to your urgent care, your primary care provider? By the way, it's 25 milligrams for your pediatric Benadryl dosage, those types of things.
Good, that sounds great.
In terms of successes, their first year, they average their first year, 3 to 6% of your call volume is diverted. By year 2 and 3, they're looking at 10 to 15% is their goal. They are heavily data driven, and 100% of calls are QA/QI'd, so are quality assured by their system. And then we get all that information back. In fact, we have a dashboard to see how the system is that's updated hourly.
Great.
Any other questions on Nurse Nav?
I add just one of the other things that when global medical readiness gave a presentation 2 weeks ago to a community, a number of folks that were pulled together by Chief Heppel and Representative Nathanson listened on in. One of the programs that they've operated is in the state of Colorado with the city of Aurora, and they received state funding for that program. And so there's a model out there for the state to fund pilot projects for the nurse navigation program. And so the model's out there, the learning's out there, and GMR's lobbyist has been active in the Salem Capitol for the past couple of years. And so afterwards we had a conversation. So I share that with you because should this become a priority, there's other resources in the Capitol that will partner with us to advance this idea so that we get more leverage, I think, in Salem. Does it? Thanks.
Sure. The second concept I submitted through Ethan to Representative Nathanson was a community response unit. This should sound familiar because it's been part of our program and our CSI efforts since 2018. Our goal was to send that out this year, but obviously due to our budget challenges, we weren't able to able to execute that. So we just saw this as another opportunity to potentially short-term fund a pilot program in that particular case, and let's see if it actually works and what the impact is, et cetera. And so in this particular case, it would be 2 folks in a pickup truck or an SUV type vehicle that are going out and actually doing the face-to-face on these low acuity calls in lieu of sending a fire truck, a truck company, or even an ambulance. Many of our calls that come out are, we're not really sure what you need, so we're gonna send something. And they can go out and take care of that evaluation. Reluctant to use the word triage, but they actually evaluate the patient, to do a patient assessment, see what their actual needs are, and then direct them in the right direction. If we pair this up with nurse navigation would be a perfect partner in this particular case, because we would do what's called a nurse navigation field initiated call. So the paramedic is standing there with the community member and go like, I'm gonna be here with you while we navigate this piece. And at the end of the nurse navigation experience, if it's you need a ride to an urgent care, part of the nurse navigation program, it comes with Lyft. Lyft is part of the transportation part of this program. And so right now, GMR is doing 30 to 35,000 transports a month across the country using Lyft right now, to send folks to the ER, to the urgent care, to the public health clinic, to the federally qualified clinic, et cetera. Sorry, I diverted back to nurse navigation there. Let me bring it back to the CRU. The CRU could probably take care of a lot of their problems too. You know, many of the challenges folks experience is just simply education. But if they determine they need a basic life support ambulance or an advanced life support ambulance, they need to see that physician in an ER, they can make those arrangements and accommodation. And the other part is they can spend a little bit more time on scene with that patient to see what their needs are, versus you look at, you know, just the sheer volume of our trucks and engines and medics right now. They're literally, it's like, what's the challenge? What's the problem? Let's get a good diagnosis. Let's get things going, and they need to get going again. And so that was this particular project. So 2 years, $2 million project, 7 day a week, 10 to 12 hour a day operation to parallel these two programs together as they go forward.
Wow.
And did you cover the bridge funding piece?
So in terms of, again, if you see the legislator draft request piece, in the second section, number 1 is bridge funding and number 2 is innovation fund. We feel that the bridge funding component would be good for the CRU. Why? Is because it has a direct impact on our system right now to get us to a better place. And hopefully that better place is that we'll fund our own CRU or the CRU, 1, if it's successful, and 2, when the funding piece comes back around with our CSI budgeting, it's already in our system, it's already planned, right? So that would be our follow-on piece. In terms of the innovative fund, that would be the nurse navigation component. We don't have that here in the state of Oregon. We would be the first system in Oregon to do that. Getting a lot of calls from Clackamas County. They're looking at doing something similar, but I'd like to be first on this one. And so that we think is a really good, nice place for the innovation fund in this particular case, and run it as a pilot.
So for clarity, the CRU unit is going to be our immediate response.
Correct.
And that could be a BLS. Or not, it is.
Yeah, so the third piece, we threw into there was a basic life support unit.
Yeah.
Which would also be part of our a bridge funding package. Sorry, that wasn't on my sheet. I forgot about it.
Yeah.
So we did also add a basic life support ambulance just to run an additional 12-hour a day car. That runs around $800,000 a year. So it would also be in the bridge funding. So to clarify, the 2 requests in bridge funding would be the CRU as well as the BLS unit, and then an innovation fund would be the nurse navigation component.
Thank you. Are there any questions?
I would just love to make a comment that I just find it sort of refreshing to think about Lyft being part of this system, alternative transport system, and it's just a recognition of how nimble Eugene Springfield Fire has been in sort of figuring things out, and then how nimble some of these other organizations are to sort of figure out what those partnerships are. So that was just an interesting fact, and it holds a lot of promise, it seems to me, as we talk about there's a whole different transportation system that's evolving, and we can take advantage of that. So pretty cool.
And I'll give just a broader view, and Chief Happel mentioned a legislative draft request. It's it's a confidential document, so we didn't share this on out. We're just looking off of it, and I didn't get approval from Representative Nathanson to use it. What she's looking at is a package of 5 different items. The first would be the bridge funding, which Chief Heppel talked about. Second would be the innovation fund. Those are the 2 pieces that the city of Eugene is most interested in keeping in the bill that she's drafting, and then having a earmark or an allocation that would come to Eugene to implement the programs that the Chief was just talking about. The third part is access to urgent or immediate care, and that could potentially be funding for Peace Health or for the community health clinics, which Lane County operates. And so there's that's negotiating, discussing. And then the fourth one is provisional or expedited licensing. We think that might be a long session discussion because it does include, and I think that you heard this at the last meeting, there was concern from Oregon Nurses Association, and they're likely going to be much more negotiation related to that topic. And then the fifth one is access to medication, enabling automated dispensing. And so from our standpoint, our focus and our priority is not on all 5 of those. It is only on the first 2, which would be core to Eugene's needs of bridge funding for this immediate response period where there would be an increase in need. And as Chief Heppel talked about, the BLS and then potentially the CRU. And then that gets us through a 2-year period, gives us funding to be able to address communities' needs in the near term. And then those innovation funds, we would ideally start a pilot, test that program on out, and it would be up and running by the end of that 2-year bridge funding. And so at that point, ESF can be taking a look and understanding, does the BLS unit need to continue on? Where's the CRU unit? Does that move forward? And as Chief had talked about, long-term funding, many of these, or there's none of these that we think that the state needs to provide long-term, because we could probably self-fund. However, if it's a pilot, like I talked about for Colorado, with the nurse navigation, if it's a pilot that actually benefits the entire state because it allows the state to reduce Medicaid outlay, then they may be interested in an ongoing funding piece. And so that's part of the negotiation that we would be engaged in. So just trying to kind of put together like what the details are from Chief's insight, and then also what our legislative strategy and the work that we would be doing is. So that, and we wanted to take a little bit of time because this is a new item. It's a #1 priority, and there's some moving pieces on it. So if there's any discussion, great, but then not, I can then talk a little bit about the full priorities document.
I just want to say that it's been really great that Nancy Nathanson has stepped into this space. I mean, she's convened a really broad group of people, and it's been, I mean, and here we are. I mean, it's a good list, so.
And I think that ESF has really stepped into leadership on how to respond to this, which has been the corollary component part that provide her the insight of what we really need. Okay, so just for clarity, what we're recommending for our priorities is #1, this secure one-time funding to provide community response to the Peace Health University District closure. #2, long-term direct funding to cities for unhoused emergency response. That's going to be in the $4 to $5.25 million for the remainder of the biennium. And that number has increased last week, or a week, maybe 2 weeks ago. LOC reached on out because the governor's office is trying to pull together a number that either they utilize existing OHCS resources or that they would seek funding for. And so our staff did an assessment of what the needs are. And that larger number of 5.25 includes a $1 million payment to go to Lane County for the navigation center. And so if we didn't get that, we'd still be at that 4.2 for all of our internal needs to keep the safe sleep shelters open, and also do debris removal and a number of the other services. So that's #2. #3 is seek funding for priority projects. And the two priority projects are Crow Road infrastructure, and we're requesting roughly $3.5 million to extend infrastructure to serve housing production. And then Clear Lake Road infrastructure, requesting $8.5 million for phase one to extend infrastructure for economic development. And then the last one, number 4, and it's still on here, support increased state investment in mental health and behavioral health systems. And really, this comes down to seeking to supporting Lane County's efforts to secure funding for the Crisis Stabilization Center. So those are our top 4 priorities. And so it would be nice to get a motion to adopt those.
Before we entertain a motion, I have a question. So the additional $1 million to go to Lane County for the crisis center, was that already programmed into the budget for the development and construction of the crisis center? Or is this additional to the original budget for the crisis center?
Councilor Evans, my understanding is that would be the city's share of operating costs for the next fiscal year.
So the state would be paying for our portion of the operating costs. Is that correct?
Yes, and that is
Okay.
consistent with what other shelters that were stood up during the pandemic with one-time ARPA funds are across the state are seeking similar dollars.
Okay, yeah, I just wanted to be clear on that. Because we got our own budget shortfall issues that we're grappling with, and if we can get that money from the state, all the better.
Yep.
So we'll entertain a motion for the state priorities. Is there a motion?
Move to adopt Oregon legislative priority document.
Is there a second?
Second.
It's been moved and seconded. Any question on the motion? All those in favor, raise your hand. It's 3-0. That motion passes.
Excellent.
All right. Let's go to the next item, Ethan.
Okay, next item, and the document that was in the email is accurate. It's the 2024 state and federal legislative policy document. And there's 2 changes, revisions that we came up with. And number 1 is under the land use section on page 3, where we added language that says Eugene supports legislation that creates incentives for annexation. That I asked our one of our assistant city attorneys and our land use planning director to craft that. And so they worked on it, and we're just bringing that one back. Then the second one.
Does that take the place of eliminate or weaken existing methods of annexation, or is that how we're amending that?
No, it's an addition. So
In addition to, okay.
The direction that came from this body was to include both the existing one, number 7, that Eugene opposes legislation that eliminates or weakens existing methods of annexation, and then add one that talks about creating incentives for annexation.
Creating centers, okay.
And then talking with the land use director, she said, let's move those down in the priority list, because annexation, there's other ones that we want to have up further. And so we slid them on down into the list. So on page 4, then on number 13, and this came out of the direction from city council at the work session just an hour ago. Eugene, so it revises the existing item that talked about ballot measure 110, and it now says Eugene supports efforts to reform ballot measure 110. And so those are the only 2 changes to the document, and that's it. So discussion.
Okay. Any discussion on the federal priorities?
Well, that's the
Or
state
the legislative,
policy.
yeah, the policy. No discussion, then we'll entertain a motion for adoption.
Do you want me to do it, Jennifer, or do you want to do it this time?
Oh, you can, sure, go for it.
All right. Move to adopt the 2024 state and federal legislative policy document to include the two changes discussed in this meeting.
Second.
It's been moved and seconded. Is there any discussion on that? All those in favor, raise your hands. Motion passes 3-0. And now we'll go on to the next item. Get out of that.
The next item would be, and for you, just before we move off of the policy document, you all received in your, in the email that I sent out to you, the comprehensive document that Chief Skinner spoke about. And I will also follow up if, and send it to the full council as was requested, out of the work session. So you'll get another copy of that. And, I think that it's you know, being able to take a look at that, and if there's things that come on up within those 11 policy items that present any challenges, that this, you know, this is really what we're all going to be working off of. And I want to make sure that there's understanding and support for these items. And it doesn't have to be all 11. So if there's any in there that raise concern, that then you say, oh, hey, we want to have another conversation about this. We have time for that between now and February when the legislative session begins. But the direction that you gave us was broad enough that it allows us to keep moving forward. And now you've got details, which as you sink on into, and if you want to think more about or have a discussion at the next IGR meeting, we can certainly do that. So just wanted to kind of wrap that discussion up from the council meeting.
Sounds good.
So then the next item would be items for community members in good order.
Anybody got any items? Well, go ahead. Go ahead, counselor. Yay.
Oh,
Or were you
I
just
don't, sorry.
yawning?
I was just yawning, sorry.
All right. Well, if nobody has anything else for the good of the order, I think we can adjourn.
Bye.
Thank you.
We'll see you
Thank
later.
you.
All right.
Take
Thanks.
off.